Hello everyone, I am Teacher Tsu from the Health Department. Today I will introduce to you how to use a pressure-metered dose inhaler. Currently, the commonly used pressure-metered dose inhalers are 5 items in the picture. Steps: 1. Put the medicine bottle upside down, shake it up and down 4 to 5 times, and connect the medicine inhalation aid. 2. Exhale gently first. 3. Completely cover the mouthpiece of the inhalation aid with your lips and place your tongue under the mouthpiece. 4. Press the medicine bottle from top to bottom once and inhale the medicine slowly through your mouth at the same time. Inhalation time, about 3 seconds for children and 4 to 5 seconds for adults. 5. After taking a full breath, hold your breath for 5 to 10 seconds, then breathe normally. 6. Take the medicine according to the doctor's instructions. If you need to use a second inhaler, repeat steps 2 to 5 after 30 to 60 seconds. 7. After use, cover the inhaler cap and check the remaining amount of inhaler. Tips for use: if the inhaled drug contains steroids, rinse your mouth with water after inhaling the drug to reduce side effects such as Candida albicans infection in the mouth and hoarseness. The above is an introduction to the operation skills of quantitative spray inhalation drugs, providing 3 key points. 1. Take medication according to the doctor's instructions and return for regular checkups. 2. Correct way to use inhalers. 3. Rinse your mouth with water after using inhaled steroids to reduce side effects. Please complete the post-class quiz. If you have any questions about medication, please discuss them with your medical staff. The Department of Thoracic Medicine at Dalin Suchi Hospital cares about you.